Marina, I was close. There's Felicia, this is why we're here. And this hottie's gonna tell us a little bit more about, about this awesome Restore place here, Restore Do More in Naples.
Yeah, so come with me. My name is Katie, I'm our assistant manager, and I'm gonna give the two of you a tour, and then whoever's watching kind of gets the benefit of it as well.
Awesome. And I got, that's even better. So they have like this really cute spot when you kind of come in. If you're waiting for a service, I bet that's probably where you'd be hanging out.
Yeah. Obviously, it's our goal to make sure that you're not waiting, as much as possible.
Yeah.
We loved when people make appointments with us too. So if you're a Restore member, or if you just so happen to be stopping by for a couple services, you can make an appointment online on our website. We're on the MindBody app as well, which is really helpful.
That is awesome.
Yeah. So Restore is actually a franchise. We're based out of Austin, Texas. We're actually the 55th store that's open, which is really exciting. We've only been franchising out for 3 years. And our kind of model is that we want to help people feel better in their bodies for whatever it is that they're doing. So a lot of people come see us for like athletic performance, either just enhancement or athletic recovery. We work a lot with people who have like chronic illness management, pain management perhaps from that as well. And then we have a whole section dedicated to anti-aging, which is amazing here in the Naples community.
Very exciting.
Yeah.
Wow.
So our first thing, and feel free to jump in and ask questions, or if anybody comments on there and has questions that they want to ask, I can do my best to answer them on the fly.
Great, thank you.
Yeah, you're welcome.
Oh my gosh.
This space is where we do our hyperbaric oxygen therapy. This is right up Felicia and Marina's alley. This is one of our medical services that we offer. Cool. And this brings 90 to 95% oxygen into your body to really promote healing in a super profound way. This is really popular for athletes who may be suffering like from concussions or from like tears or injuries in the physical body. But it's amazing for cognitive health as well. So even if you're someone who's working at a desk and has a lot of like meetings to go to, a lot of things to try to remember, this can be really beneficial for that.
I probably need some of that. It helps you. It helps with memory, huh?
Yes, it's huge for that.
How long do you usually stay on?
This is actually kind of a prescribed treatment, so we work with physicians and with doctors. If you're not coming to us from another physician or doctor, you'll have a conversation with not only our registered nurses on staff, but then we'll do a telemed service, so you can talk with our nurse practitioners as well. And they'll be the ones who make the recommendation for the amount of time you're in here, but it's usually about 60 to 90 minutes.
Wow.
Yep, so this is under 1.2 atmospheric pressure, so it takes about 10 to 15 minutes to fully come up to pressure, and then you'll be in there for about the 60 to 90 minutes for the session, and then about 10 to 15 minutes to decompress as well.
Okay, so wait, so you're actually getting inside there? It's not just like you don't just like lay on top. I just thought I just assumed. Oh my gosh. You guys, you actually have to get inside. It's almost like something out of the spaceship, I feel like. It looks comfortable though.
Cozy spaceship you'll ever experience in your life. Most people won't experience spaceships. Yep, there's air conditioning on the inside, and this actually fully blows up to twice the amount of size.
Okay.
You can bring in your laptop and work while you're in there.
So you don't have to be like sleeping or something.
No, you will have the best nap of your life while you're in here. But if you want to get some work done, our owner Nick is obsessed with this. Not only because it helps him a lot with, he's huge into working out, but then he's got so many different things going on as well, so it's great for him to actually be able to get emails answered and whatnot. So we call this the little HBOT timeout when he spends some time.
Cool, that is very interesting. I had no idea.
Awesome. And it's one of those things that, not a ton of people know about until they need it.
Yeah.
Well, what's great about a lot of the services that we do is that we're trying to prevent things from happening in people's bodies in the first place.
Right.
So of course, if someone is coming in with an injury or something that they're like trying to nurse or heal, we 100% want to support them in that way. But if we can prevent things from happening in the first place, that's really huge too.
Yes, this is right up my alley. Yeah. I like it. I know.
So this next space is our esthetician's room. Our esthetician's name is Rebecca. And in this space, we'll be doing hydrofacial treatments, which is something that a lot of people are really in love with. It's kind of like a cult favorite. Like once you do a hydrofacial, you may not ever go back to another type of facial. And then we do cryo skin treatments as well.
That's all the stuff they use in there, I bet, in the big
Like the
hydrofacial.
cryo treatment is just for the face, or do you apply like certain body parts too?
So the cryo skin actually has 3 different settings to it. So we can do a cryo skin facial, which helps boost the collagen in your face, helps with the elasticity. And then we do the cryo skin toning, which kind of tones up any areas that you've been working on.
Does it kill cellulite?
So the slimming is what helps with the fat loss. We bring the cells through a process called apoptosis, which literally kills off the fat cells. We kind of call it like if you've got an inch to pinch, this is like the nice thing that can kind of round off whatever you've been trying to like work out.
If you guys could see me raising my hand, it's being risen.
All hands are going up right now. Exactly.
Show the camera.
I know. How do I hold on? Let me. Yeah, raise my hand for that. You guys, I know I'm not the only one, ladies. It doesn't matter how fit you are. It's genetics, mostly genetics, I would say, as far as you know. What we were talking about
some areas.
Cellulite.
The stubborn fat.
Troubles that. But I'm gonna be honest. If I had shorts on, I would show you. This is my bad spot. I don't necessarily have it on my left leg.
Doesn't look bad from here.
I don't have it in a lot of places. But I do have cellulite, and if I do, it's here. So I'm very interested in that.
Yeah, it's.
I've never
really
done
cool,
it,
it's a
but
really
it
cool
could
process.
be. It's like that last kind of like. It's the finisher. This isn't a magic wand that's gonna make your life.
Pretty close though.
But it sounds more like a finishing wand.
Yes.
This sounds great after a brookie.
No. She's giving me up. We had brokies after our lunch today.
Oh, nice.
All right.
So yeah, this is our esthetician space. If anyone's interested in having a consultation, either for hydrofacial or cryoskin, our esthetician Rebecca, who's actually standing behind you right now, would be more than happy to chat with them about that.
Okay, good.
Moving down the hallway here, this is our infrared sauna, and I'll turn the lights on for you because it's got some moody lighting in here.
Ooh, yeah.
So the infrared sauna is different than a typical sauna because it uses the infrared.
It's a nice shower
heat.
too.
Yeah, you can definitely shower afterwards. This is kind of like your sanctuary for the space and for the time that you're in here.
Yeah.
But the infrared sauna is nice because it helps heat the body in a different way than what you would experience from a sauna that uses steam.
Oh,
it's
wow.
so much easier to breathe. And it actually works by heating the body itself, not just the space that you're in.
Okay.
We also use the cryotherapy lights, which is an extra like cherry on top of the sauna treatment. So different light therapy does different things in the body.
Oh.
We're huge into light therapy here, so we'll be talking about that in just a minute. But if you want to step inside to look at the whole sauna, feel free to step in.
It's not gonna like let any of the good stuff out, is it?
No, you're good. We preheat it before every session, of course. And then we do either 60 or 45-minute sessions in the sauna. And on this little TV right here, we have Netflix. You can just kind of like pop into Netflix and get your binging on while you're detoxing the body.
I guess so. Can you expect to be sweating a good amount in here? Is it hot enough that you're going to be pretty heated? So you should wear like fitness wear, or?
So we want you to dress to your comfort.
Okay.
When you are sweaty, of course, that means maybe wearing one of the spa wraps that we provide, maybe wearing a sports bra or other undergarments.
Okay.
But we want this to be your sanctuary space. You know, we want you to feel as comfortable as possible in here.
Do double life.
Oh gosh, I love it.
So yeah, we want you to feel comfortable. We'll provide you with as many towels, as you need, and then you can shower right after as well.
Okay.
If you're coming straight from the gym, this is kind of nice because you're already sweaty. Or if you're maybe coming to and from the beach,
Our
something
gym
like
happens
that.
to be very close to here.
Ah, perfect. Mm-hmm. Convenient how that works out, huh?
Yeah, I'm sure that was no accident. So you did mention memberships. Obviously there's going to be different packages.
Yeah, I'll tell you all about it when we get to the end.
Okay.
Sound good?
Yep.
Cool.
Hang in there, guys.
So this is our infrared sauna. It's called a sunlightened sauna. This is a two-person space. So if you and a loved one want to enjoy the sauna together, you can definitely do that.
Look at that.
Package with some wine and some
We'll
chocolates.
have to put together a romantic evening for something like that.
Whoa, hey.
So this is my, I know, it's a little bright. I'm not sure how it's going to show up on your phone. It might take a second to adjust.
So is this something where you should have eye protection on?
No, it's actually amazing for the health of your eyes.
Oh, good. Can I bring my dog?
dogs actually love this. Actually, they really do. I'm a huge dog lover.
I'm
myself.
serious. My dog is 14 and his eyesight is going. This would be really nice for him, I feel like.
So this is called PBM. It's short for photobiomodulation, and that's our near red and then the infrared light therapy.
Wow.
So the way that I like to explain this is because we as humans spend so much time underneath artificial light in front of computers, laptops, cell phones, of course. Our bodies aren't getting the full exposure to the wavelengths from the sun that they should be getting. So our brains aren't producing like the type of chemicals that they should, so we can function at our best. If we were spending time outside, we wouldn't need the panels like this, but
sure.
It's 2020, so we do spend a lot of time inside. So this kind of helps supplement one of those natural things that's found on Earth. So you stand in front of this panel here, you stand on this comfy pad, and then you're gonna pull this one nice and close to you.
Oh, kind of like a tanning bed.
Kind of, but one that's really, really good for you.
Right, right.
So you stand here with about 4 to 6 inches on both sides. This is one of the treatments that, the more skin exposure, the better. And the way that this works is that when you're standing here in this session, the red and the near infrared light is providing your mitochondria in your body with the energy that it needs to not only do things you love, but to just function as a whole. So when the body is getting that ATP, we're also actually developing the melatonin in the brain that we need to properly sleep at night. So not only is this really great for sleep, it's also great for hormone balance, it's amazing for hair growth, but what's most important to me is that this is helping our muscles recover at a deeper level as well.
Oh, wow.
So near infrared light gets deeper into the body than the red light, but the red light is working on the first couple superficial layers of the skin, so it's amazing for fine lines, acne, scarring. It's helped my skin a lot just from working here a couple months, which is amazing.
Yeah. Your skin does look good, so.
Thanks. So yeah, this is our PBM room. This is amazing to do right before a cryotherapy session.
Okay.
And then these 3 dressing rooms here are what you pass through when you're going to go do a cryotherapy session. So doing PBM right before cryo is really great. We're actually going to walk you around the corner here, and then we'll walk you into our cryotherapy room.
Okay.
So your eyes may be adjusting. The
Yes.
blue-green is a little bit different right now. It'll
Totally.
take a minute, but it'll catch it. So we're going to go around this way.
Okay.
And this is a really cool light. Not only does it make for a good conversation piece,
Yeah.
it also is just like hey, we've got someone doing PBM in here.
Oh, yeah, nice.
So we'll come down the hallway this way, and I'm going to open this door, and then this is where we do cryo. So go ahead on in.
Oh, yeah, I've heard about this. Now, can you tell me, because isn't there like a cryotherapy of Naples too?
There are
That's different, right?
There are different cryotherapy locations in the area and all over the country, but what we love is that we have the Cryo Arctic machine.
Okay.
This is the highest quality cryotherapy machine out there.
So there's different qualities of cryotherapy.
There are, definitely. And
Interesting.
the reason that we love this machine, and to my knowledge, there are not other places in Naples that have this machine. They have what was the highest technology
At the
maybe
time.
2 years ago.
Sure.
Now this is the new one.
Okay.
So the Arctic is really nice because it has this window here. I'll actually roll it down for you so you can see.
Oh, it's already cold in there.
Yes. We keep it pretty chilly.
It's like a refrigerator. It's like a refrigerator for the body.
The fanciest
Oh my gosh, it
refrigerator
is
you've
really
ever
cold.
seen. Yes.
Yeah, this is different than what I've seen people do where their heads are out.
Yes. So the reason that we want as much of the body inside of the Arctic chamber as possible is because the nitrogen vapor is actually able to access the vagus nerve in the back of your neck, which is what controls talking to the body to get all of the good things out of it. So when your head is out of the machine, you're kind of missing the whole point.
Okay.
Yeah, so we can roll the window down to your comfort. Most of us kind of keep the window at about chin level, not only so that way you're able to see and talk to people as well, but so that way you're kind of able to get good videos and pictures as well.
Right, all right.
This door is just on a magnet, so I'll open it for you so you can see the inside. We're not running a session at the moment. Usually when we open the door, all of the nitrogen kind of spills out.
Right,
and it looks like you're in a big cloud. But you would stand in here for your session, and then we'd roll the window down to your preference. We've got a Bluetooth speaker in there so you can jam out to your favorite pump-up song. I'm a yoga teacher, so I love to zen out in this space.
Yeah.
Very mind over matter kind of thing. And we've got 4 different levels for the treatments. So the purpose, I'm naturally kind of a competitive person. So a lot of the times when I'm like, oh, there's the coldest setting for the longest time, that's what I'm going to get. Right. But actually with this, we're really looking for about a 40-degree drop in your external body temperature. Okay. So it's not about how long can you be in there for how cold, it's just how does your body react to the cold.
Well, and that's going to be different for everybody.
Exactly. That's why we have different levels.
Okay.
So the warmest it gets is negative 160 degrees, and then it goes all the way through negative 220 degrees to our Cryo Pro level.
Okay.
We usually start people out at about 2.5 minutes at beginner, just because we do want to see how your body is going to naturally react to the cold and how it's going to warm up afterwards. What's really nice too is that we're going to take your external body temperature before you go in. We're going to take this on the back of your calf, and we're going to record
back of my calf. That's so random. Not right now.
Oh. Okay,
you need to peer in your life.
Back of my calf is ranking right now.
And we'll do this whole thing before you actually do a session right now too.
So is this actually the same type of thing they might be taking my temperature with if they were checking me for COVID somewhere?
No, this is just the external body temperature, not the internal.
I mean, would they shoot my head with that somewhere, or what are they doing?
I don't know.
Are they checking?
I don't know what they're doing.
I have no idea, you guys. I'm just.
I can tell you what we do here, though.
Fair enough.
So we would take your external body temperature, and like I said, we're looking for about a 40-degree drop.
91, is that normal?
Yep, normally about like 88 to like 91 is about like where most.
You're hot, girl.
There you go. Real hot. So then after you get out of your session, which like I mentioned is about 2.5 to 3 minutes, we would take your temperature again. And then kind of depending on how your body reacted to that, we would be able to adjust the session next time you come in. So maybe you need more time, maybe you need less time, maybe you need a colder temperature. Like everything else we're doing here, we really want to customize it to exactly what's going on in your body and like what you are looking to help get some relief from.
Mm-hmm.
So that's why we have the different levels.
Okay.
Are you familiar with the way that cryotherapy works in the body?
Nope.
Cool, I'll tell you all about it.
Awesome.
Right? Like,
tell me. Here we go.
So the reason that cryotherapy helps get rid of inflammation in the body is because the body literally thinks that it's freezing to death. Your mind knows that it's not. You are super safe. We are with you the entire time. But because the cells in your body literally thinks it's freezing, it's going to bring all of the blood cells from your hands, your feet, your arms, and your legs in to protect the organs inside of your body.
Makes sense.
When you step out of the chamber and then for the next couple hours afterwards, your cells start to come back out to your arms and to your legs, and they're actually able to get into parts of the body that they may not have been able to move to as smoothly as before. So that's how the inflammation decreases in the body.
So you may or may not know the answer to this. I don't. That's why I'm asking. I actually have thoracic outlet syndrome, and so I have when I'm working out or using my left hand a lot, I will lose blood flow. I don't have a radial artery. It was blocked, and long story short, I just don't have great blood flow in my left arm. But this sounds like, kind of like if you've ever done Bikram yoga, there's a few poses that force blood into places that you're not used to. This is just a different way to get all those things kind of moving and clean things up a little.
Right, so I'm glad that you brought that up. Knowing someone's medical history when they come in is one of the things that we take into huge account. You know, we want to make sure that all of the modalities that we're offering are going to be beneficial to you. So because that is something that is happening in your body, you have a conversation with Felicia and or Marina, and then we would probably do a telemed service just to make sure that our nurse practitioners would be able to clear you for that. There are people all over the country who have been doing services like this who experience different results for different things.
No doubt.
So I'm sure that there's someone who has an amazing testimony to that, but we just want to make sure that it's going to be beneficial for your individual.
Absolutely.
Our nurse practitioner clears for all medical modalities in store.
Perfect.
So if you had specific questions about clearance for this that maybe you weren't sure you could go through, we can give you a general idea, but we would recommend you see your general physician.
Right.
So direct questions on, just because this is not a medical modality,
Of course.
covered under our medical license.
Awesome.
Cool. So you're actually going to get a huge energy boost from this. You're going to release a ton of endorphins while you're in there. It's amazing for your metabolism as well. So maybe that means you don't need to do the extra workout at the gym. You can just come.
The brookie's going to be taken care of.
Awesome. Right now, right here on my belly. It's right
It's all
here.
right here. You guys, we have the hugest brookie at, Steve, the table was so big, it was so good.
We had to split
never
it.
been there before.
Oh,
I know. I've heard it's amazing. We'll have
next
to go.
time we'll bring you some cookies. I have a question
Yes.
regarding workout. Is there any recommendations we should work out before, after? Doesn't matter.
Some people, just like all of our other modalities, some people have different preference to it. So some people like to come get in the cryo chamber before they go work out at the gym. Some people would rather do it after. We want to see what's going to show up in your body best.
Yeah.
The thing that we just do want to make sure that we're taking into consideration is that we can't have any moisture in here whatsoever. So if you're coming from the gym and you're rather sweaty, bring an extra like sports bra or something like that.
Okay.
You can also always wear one of our spa wraps instead. We can give you towels to kind of remove that moisture.
I think I lost when you said that. So you go in with clothes, because the other cryos you go as you came into the world.
So we want you to go in to
Just with
comfort.
socks. At least the ones I did.
We want you to go into the comfort of your level.
Okay.
We do have some safety procedure protocols for that though. So we do give you a pair of like shin high socks that you wear and slippers.
Okay.
We want to keep protecting the extremities, so we give you a pair of mittens as well.
Okay.
And then of course protecting all the goods is really important. So we do ask and require that females wear sports bras or sports wrap, and then everyone needs to wear undergarments while they're in there as well.
That's good to know.
Yeah.
I feel more comfortable like that.
Good. And
Not
plus
knowing that
it's in an
I won't
enclosed
freeze in
space.
certain areas.
We want to keep all those good areas in there.
Yes. There's no fat to be wasted in there.
All right, so moving on. So this is our cryotherapy room. Just like a lot of our other modalities, and like most things in life, if you start like a new diet or a new workout, the results you're gonna like start to notice pretty quickly, but the more you keep it up, the more you're gonna notice in your body.
Yeah.
So for some people, you'll see probably a difference after like 3 to 5 sessions, but really like 10 to 12 is when you're gonna start noticing a huge difference in your body.
Interesting.
Yeah.
Okay.
So we'll walk through this space.
And you said that the cryotherapy is just a few minutes at a time?
Yes. So
Initially?
we usually start people off at 2 minutes and 30 seconds.
Okay.
And then it goes up to 3 minutes.
And then I you might have said it, but I forgot. Did you say how long is the red light therapy?
Red light therapy is about a 12-minute session.
Okay, so we've talked about like a 60 to 90 minute with the oxygen. We've got like a 12-minute with the red light, and then just a 2 to 3 minute here in the cryo now.
Yeah.
Okay.
Yep. So
Great.
lots of options, kind of depending on what's going on in your body, what areas that you need a little more restoring in. No pun intended.
Yeah.
Fully pun intended.
Right.
We want to be a service or a place that people can come to in between running errands, but we also want to be a place that someone can come spend the whole day with us as well.
Oh, wow. Okay.
So kind of based on what's going on in your body and depending on your scheduling, we can modify whatever it is that we would be offering and recommending to you that day.
Great.
These are for those things you put on the legs, right? Too.
Yes, yeah. So this is our compression therapy. We use the Normatec sleeves. These are, again, the most high quality ones you can get in terms of compression. These are used by collegiate athletes and professional athletes all over the world, and just regular Joe Schmo people too.
Cool.
The way that this works, I usually, depending on my audience, I either like to explain it as the tallest pair of thigh-high boots you've ever worn in your life, or a pair of waders. I feel like each person either kind of knows one or the other.
Yeah.
So we have you sit down in one of our chaise recliners, or you can sit in one of our anti-gravity chairs. And the way the compression works is it's got a couple different chambers in there. We use the Normatec pumps to bring the air. It starts in the foot of the sleeve and then works its way up through each chamber. And then the chambers are working synergistically together to relieve things like the lactic acid that may be built up in your body. That's what creates the soreness. We also are using it to help drain the lymphatic system. And it's kind of like our version of a sports massage, so it feels fantastic on your legs, especially right after leg day.
And do you put both legs in one, or you get 2 legs?
So you get a leg for each leg,
Okay.
of course, and then we can also do this for the arms and for the hips.
Oh, yeah.
You could do arms and legs at the same time, but then you'll kind of look like the Michelin Man and just kind of be like hanging out.
Sounds worth it.
Yep, it is. And then the hips, of course, we wouldn't do the hips and the legs at the same time because we want to just focus on one area of the body for that.
So when you do your hips, are you lying down?
Yes, for the hips, we do have you lie completely flat. Our chaise lounges do lie completely flat, and then we can put a pillow behind your head. We'll snuggle up with a blanket if you want to. You can do work on the laptop while you're there. You can chit chat with people in the room, read a book.
Cool.
Yeah.
Do an IG Live?
You could go on IG Live. Yeah. So in this space is where we also do our IV drips, which are done by Felicia and Marina.
Oh yeah, IV drips. So like if I have a really good time with my friends.
So you want to come see us first.
Oh, okay.
It works afterwards too, but
Okay, so tell us
pre-party
about
with
that.
us.
So we pre-party before
Yes.
the party.
Yes.
And tell us why we would want to do it like that,
So
Felicia.
you would definitely be more hydrated. You've got those nutrients that your body needs to kind of help recover. So
Okay.
you pour those into your body before your weekend festivities. It helps you to recover a little easier. Great to do it afterwards also. There's no harm in that. But definitely you'll feel the benefits a little better done before.
So it's not going to make me have to drink more, though. It has nothing to do with that.
No.
Okay.
Or it can allow you to drink.
Yeah, hey, that's positivity.
Whatever
there.
way you want to do it.
I mean, just saying.
Yes, no, this is more focused on your recovery from it.
Okay.
Our drip menu has anywhere from just fluid, maybe you just want the hydration, or you have 2 ingredients that we can add. We can add 4 ingredients up to 12 ingredients. Really, it depends on what you're looking for from the drip. All of our drips are custom cocktailed for you. So we have an idea, kind of like at a restaurant, what we think would be great depending on what you're here for. But if you say, actually, I don't want this, or if there's a medical reason why you couldn't have a certain supplement, then we can exchange it out.
Tweak it.
Yeah, tweak it to cater you specifically. And then we also do micronutrient testing here. So that looks at a 3 to 4 month span of how your body is receiving and what your micronutrient levels are. And then we can cater your drips specifically to those results also.
And so the micronutrients.
Gut health we're talking about.
Yes, that's what I was just going to say. So how do we test the micronutrients? Is that a blood test? Is that a...
It's a blood test, and it's ran off of a lymphocyte instead of like a red blood cell. So that's what allows us to look at the last 3 to 4 months of your micronutrient lifespan.
Cool.
So what your body's been doing
For the last 3 to 4 months.
Yeah.
And really because...
Suitable for quarantine.
Yeah.
What have you been eating?
Yes.
Let's take a look.
And then taking oral supplements doesn't affect your reasoning or need for IV supplementation. So you would still continue to take your oral supplements. The bioavailability of what you're taking at home or your oral supplements is about 15 to 20 versus taking anything IV or IM is 100%. Your body's available to use it at its need. Versus taking things by mouth, it's all based on your individual gut health and how you're going to be absorbing those things that you're consuming.
Right.
So that's the benefit of taking things IV or intramuscular.
Okay, so bioavailability means basically how your body is using what you're either ingesting or in this case injecting.
Right.
Is that even the right word?
So it's how your body how it's available for your body to use.
Okay.
So I can take the same dose by pill, but if my gut isn't in a healthy state to really absorb and break that down, then I'm going to get less of it than what I'm actually thinking I'm getting.
Interesting.
Even if you have a super healthy gut,
Right.
you still lost a lot just through the digestion.
Yes, we digest and lose it through bodily fluids, a lot of our oral vitamins.
Yeah. Wow. So then how often would people, once they have this micronutrient testing, how often do they want to retest for that? Would it only be every 3 to 4 months because that's the cycle, or how?
So you could see what you're deficient in and replace based on that. If you're interested in following up 3 to 4 months later to see if what we've done has made an impact, then that's always an option. But just kind of having that knowledge of what you're deficient in, like people who bruise easily may be deficient in vitamin K. So knowing what our analysis of that test result gives you, all of that information, it tells you nutritional recommendations, and it kind of gives us an idea of what we need to replace to help you function at your best.
Awesome.
Yes.
Very good. Do you have any other questions?
Right,
I know,
we're not
it's-
even done. We still have a couple more things to chit chat.
Oh my gosh, there's more?
There's more, but wait.
But wait, there's more.
So this space in here that we just kind of looked at is nice to meet new people in. It's nice to chit chat with friends. We kind of call it like our open IV drip room.
Okay.
And then if we walk back into this space, this is what we call our private IV drip room. So if you have some important phone calls that you need to make, if you're coming to get a drip or compression done in between doing something for work, if you want to bring a client in, if you're looking to bring a significant other or a close friend, you can kind of do that in this space too.
Okay.
These are a store favorite. We were obsessed with these. These are anti-gravity chairs. The back of these chairs come completely parallel to the ground, so it takes all of the pressure off of your low back. They also vibrate and heat, so getting an IV with this and compression is like the best.
Better than mine.
It's the best. And then in this space back here is what we call our stretch space. So this is where we do hands-on assisted stretching with our Stretch Tech Olivia. This program is something we'll be launching in July. We're actually sending our Stretch Tech Olivia out to a week-long corporate training where she'll learn the stretch protocol.
Cool.
So what this is really nice for is people who may be either recovering from an injury or trying to prevent something. But a lot of the times, we can only stretch ourselves so much until we need maybe an extra set of hands to provide that extra bit.
Yeah.
So we use tools like the Hypervolt, which is a percussion massage device. It helps get knots out of the body. It helps relieve tension out of the body as well, and kind of warms you up before the session. And then kind of based on how your body is feeling, our Stretch Tech will provide recommendations and do things specifically that would benefit you the best. So if you have really tight hip flexors, we would focus on that differently than we would if someone was, working on a shoulder injury. We also use localized cryotherapy back in this space as well. So it works pretty similar to the cryotherapy chamber, except this is in a localized version. So we spend about, depending on the way that the body drops in the temperature, we're looking for about like a 10 to 12 minute session, but we want to keep the body at about like a 45 to 50 degree range while you're getting that service. So this is like using ice to like heal something on steroids.
Yeah.
It actually allows the blood cells to heal the area that has super inflamed or has a different type of injury much better than just icing something would.
Great. Yeah, it's just like a deeper icing.
Exactly. Yep. Yeah.
Wow.
So that's officially everything we do.
Wow.
Yeah.
Claps.
We need to get you guys in cryo. Yeah.
Wow, you guys, we have an amazing place here.
I know.
I don't really have all this. Yeah. Thanks for bringing me, girl.
Yeah, you're welcome. Thank you so much for that. And I hope this
it's my
is helpful
pleasure.
for some other people. I have one more question.
Yeah.
I feel like because this is preventative health, this is going to be a tough one for some people to want to spend money on because of their own thinking that they don't want to spend money because they don't have an issue. But really, they probably do. They just don't want to address it, right? So my question would be, are insurance companies jumping on this bandwagon and are they acknowledging how important preventative medicine is? This isn't necessarily medicine, but this is a form of healthcare.
Yeah, so I think, with everything kind of going on in the current world and the current environment, a lot of preventative measures are now being taken into a huge importance, and they weren't before.
Good.
I think people are kind of waking up to that.
Yeah, agreed.
Restore has been around for a number of years, and it's amazing that people are now starting to understand how important that is.
I'm just thinking about how much I've been sitting and how my hip flexors are really tight and how many other people are also in that same scenario and they don't even know that it's their hip flexors that are tight that are making their lower back hurt. So
Exactly.
I get, are insurance companies paying for these types of services?
So Restore is actually a cash-based model,
Okay.
and what people will find is that our services are so much more affordable than it would be if you were to go through insurance.
Cool.
There's some things that we can use for like FSA and HSA accounts.
Oh, perfect.
We can make that happen and apply for that. So if you have that benefit fit like through work or something, we can definitely make that happen.
Cool.
But the way our membership pricing works makes it super affordable. And our motto too is that you can only train as much as you recover.
No doubt.
So if you're training a ton and like working out a ton but not doing any recovery, you're gonna hit your limit.
Yeah.
So we want to help restore the body and recover the body as much as we possibly can, so that way you can keep doing what you want to do.
Cool. So where can people find more information?
Yeah, so you can check out our Instagram page. It's restore_Naples.
Okay.
You can also go to our website. It's restore.com/Naples, or you can obviously give us a phone call or stop by. We're at 6340 Naples Boulevard, kitty corner to the Lowe's and right in front of the movie theater.
Awesome. Thank you so much. We appreciate
It's
you.
our pleasure. We'll see you all soon.
All right.
Bye. Let's get you in cryo.